I'm Kathleen K. De Vega from the La Salle University Medical Center in the Philippines, and today I will be presenting a case report entitled Staying Alive. Here are the contents of my report. We are presented with a case of an unidentified female estimated to be around 16 to 18 years old. The patient was brought to the emergency room by a group of nuns, and she was found outside a convenience store, curled up in pain, covered in blood and grime, and surrounded by flies. Initially, she was thought to have been hit by a vehicle. What could have happened? The rest of the body was normal except for some notable findings in the skin, head and neck, and sensorium. Findings in the skin include multiple erythematous papules all over the body and matted hair with numerous head lice. Head and neck findings include numerous larvae protruding from the left ear and the left eye. Neurologic signs show a patient who is awake, irritable, not oriented to time, place, and person, and could not communicate verbally. Initial ophthalmologic examinations show positive visual threat on both eyes. Grossly, left periorbital swelling is seen with erythematous conjunctiva and multiple larvae seen protruding from the left palpebral fissure. Other structures in the left eye could not be assessed initially. So we are left with a question. Insects in a living human? Well, it's not that uncommon. Flies, particularly those belonging to the Diptera family, come in swarms and can be quite a nuisance to humans. They move from person to person and can transfer certain diseases. They are attracted to a variety of things, but most notable medically are decomposing tissue, blood, and physiological secretions. They can gather around mucosal surfaces such as in the eyes, ears, mouth, pharynx, and genitourinary tract, and can lay their eggs there. How does a fly live? A fly completes its life cycle in 10 days. An adult can lay up to 500 eggs, and these eggs must remain in the moist environment for them to hatch. The larvae develop in 3 phases and proceed to the pupal stage in about 4 to 13 days. The adults emerge and can live from 15 to 25 days. Where do they thrive? So the larvae can thrive in warm environments, especially in tropical and desert areas, in farms where cattle and livestock are raised, and in areas with poor hygienic practices. Flies in the eyes? So the larvae can be found exclusively in the external eye, which includes the eyelid, lacrimal duct, and conjunctiva. Some can burrow the eyeball and reach the aqueous, vitreous, and subretinal spaces. Some penetrate the orbit and other adnexal structures, including the optic nerve. How can it happen? Adult flies lay eggs at or near the conjunctival sac. The eggs hatch and the larvae eat dead tissue in the eyelid and conjunctiva. The larvae may burrow through the sclera to the aqueous chamber, vitreous, and subretinal spaces, and they may die in the external or internal eye, causing inflammatory reactions. They do not complete their life cycle in humans. What species are significant to human eye infestation? Listed here are the species commonly seen in the external and internal eye, having the most common Estrus ovis or the sheep nasal botfly. These species are not locally seen in the Philippines except for Musca domestica. What have we found in our patient? We saw that the larvae were creamy whitish in color, cylindrical but tapering towards the head with one pair of dark hooks. Based on the morphology, the patient's history, and the occurrence of these larval species locally, this led us to conclude that the larvae found in our patient may be from a common housefly. What we did at the emergency room was we sedated the patient and instilled topical lidocaine on the left eye. Mechanical removal of the larvae was done, and fluorescein dye was instilled, which showed minimal superficial abrasions on the left cornea. The patient was given initially erythromycin eye ointment 3 times a day on the left eye. Plain orbital CT scan was requested, and it showed soft tissue swelling on both periorbital areas, more on the left. The globes are intact, and extraocular muscle display normal with no evidence of inflammatory changes. At the wards, the patient was reassessed. Visual acuity showed positive visual threat on both eyes. Grossly, we noted decreased periorbital swelling and conjunctival hyperemia on the left eye with no bleeding and discharge. Fundoscopy revealed no larvae in the vitreous and subretinal spaces. No corneal fluorescein dye staining was noted, and patient was switched to tobramycin plus dexamethasone ointment 3 times a day on the left eye. The patient was discharged 2 weeks after admission. What could be the possible complications? Complications can be noted depending on the site of infestation. Externally, periorbital inflammation and corneal ulcers may ensue, and internal infestation may lead to uveitis, retinal detachment, and optic nerve involvement. Progression may lead to severe loss of vision, blindness, or loss of the eye. Given the salient features, we are given a patient who has fly larvae confined in the conjunctival fornices, no evidence of maggots in the anterior and posterior internal eye, and symptoms improved after removal of the larvae in treatment with antibiotics plus steroid ointment. What could be our diagnosis? Our diagnosis is ophthalmomyiasis externa of the left eye. Thank you very much for listening. So, in behalf of the group and myself, thank you, Dr. Andrzej Grybowski and Dr. Perfecto Kagampang III, for inviting us to this wonderful event.